Hi, I'm Miriam Detskovsky from Tebra. If you've been following our State of the Independent Practice series, you've likely already seen what connected workflows could unlock for your practice. Today, we're going to show you what that looks and feels like inside Tebra in a real clinic day that runs across EHR, billing, and patient experience. I'm joined by three of our product marketing leads who live in these workflows every day. Hannah Abrams, who covers our EHR, Kevin Clinton, who covers billing and payments, and Samantha Berquist, who covers patient experience. We'll move through a connected day in the order it actually happens: clinical work in the EHR, getting paid for that work through billing and payments, and everything that patient experiences along the way. So before we get started, Hannah, what do most providers want back from their day?
Time. They want time back to do exactly what they want. That could be enhanced patient care, research, or getting to truly log off at the end of the day.
So Kevin, in a couple words, what keeps revenue leaders up at night?
I have to say leakage and unpredictability. The clinical work, it's getting done, but disconnected systems means revenue slips through the cracks or shows up weeks late. I think that uncertainty is the number one stressor really for billers and practice owners.
Samantha, what's the number one thing patients expect that many practices still struggle to deliver?
The number one thing is a consistent and high quality patient relationship with the practice. And I think that extends to not just in person in the office, but also means digitally.
So I want to dive into a little bit more into the clinical side of the day. So in our data, 63% of practice says automation saves their staff fewer than 5 hours a week, and many are still just exploring automation or AI. But the practices that report increased capacity, adoption of tools like templated notes, eLabs ERX, and digital intake is dramatically higher. And we have a customer who recently implemented our AI Note Assist that I'd love to talk about for a moment, and how Dr. Arjun Reyes used Tebra's connected EHR and AI Note Assist to reclaim 3 to 5 hours per provider per day.
Yeah, so Dr. Reyes and his associates, those providers were apparently before using our AI tools, finishing notes and jumping between disconnected tools. But then after moving to Tebra's connected EHR and turning on our AI notices feature, they reclaimed, like Miriam said, 3 to 5 hours per provider per day. You can imagine how quickly that adds up per week, per month, per year. So notes were finished faster, documentation stayed inside the visit, and burnout dropped because the work stopped following them home.
That's amazing. So I know we're about to shift into a demo, but before we do, what should providers watching this look at in this demo specifically so they can picture their own day in it?
I think as providers watch this demo, they're going to want to pay attention to how often documentation actually gets done during the visit, not after, and how rarely we have to switch tools because everything is all in one, making it super easy. And this is what a connected day actually looks like. Intake flows into the chart, notes drive clean coding, and orders happen without leaving the encounter. The goal is for you to be done documenting when the patient leaves the room. Okay, so let's walk through a fully connected day, starting before the patient even arrives, through the encounter and into orders. Everything shown here is web-based and HIPAA compliant, so teams can securely log in from anywhere. No downloads, no local servers. For mobile access, there's also an iOS app. So before the visit, we see Samuel Claus is scheduled. Let's check him in. And we're going to take a look at the patient intake that he already filled out ahead of time. Profile forms, medical intake screening tools, and fully custom forms are all available and supported through Tebra. So practices can send their own consents or agreements by text or email, allowing patients to complete everything on their phone or computer before the visit. So once intake is submitted, it flows directly into the patient chart with one click. Merge, no scanning. So let's go ahead and merge into chart. Now that information will appear in the patient face sheet. So if we click into that appointment, we can check out the patient's demographics with those pre-populated fields. Here you go. No toggling back and forth. Now, if we want to document, there are a couple really great streamlined ways to do this. So let's go back to our dashboard. Inside the encounter, providers can choose from multiple documentation paths: notes, prior note, pull forward for follow-ups, customizable templates, or fast text shortcuts built for speed. We even have AI-powered scribing. So here's your standard SOAP note. If the patient is coming in for another appointment, and this is not the first visit, you can always pull what we like to call a salt note, which is same as last time. So it pulls forward those details from a previous visit. So for here, you would go through with your patient, filling out each section. You can add prescriptions right in the modal. Same goes for labs and studies. We support both labs and studies and imaging. So you would just fill that out here, add in your patient diagnosis code, and it will be sent to you, and you'll get those results back within your EHR. And then something else, you can add your ICD-10 codes right here. Let's say for this one. So since the patient is coming in with a cough and a fever, we're going to identify this as a flu. Okay, great. We'll include that. And now that will be ready for any coding that needs to be done after the visit. Let's go through some medications. Okay, so since this patient came in complaining of a cough and a headache, we just want to make sure that we're giving them all they need to feel more comfortable. So let's go ahead and prescribe this patient something to help. Going to go to add prescription. Flonase will be the way to go. Fill out a couple details. These recommended SIGs pull forward automatically based on the medication you filled out. The patient's preferred pharmacy is already here because of that previous intake they filled out. And what's great is real-time coupon pricing appears alongside prescriptions through our GoodRx partnership, which helps patients find lower cost options and improves medication adherence at the point of care. So now we're going to show Tebra's AI Notices feature, which saves providers up to 70% on their documentation time. I'm going to click AI Notices. It's already connected to the right patient. I'm going to choose a SOAP note since that's typically how I like to document. And then once I'm ready, I'm going to click Start Listening. Samuel has come in today complaining of a persistent cough, a really bad sinus headache, and a low-grade fever that he's been experiencing for the past 3 days. I would like to run a full respiratory panel, get him some Flonase to ease the symptoms, and I want to make sure he, of course, doesn't have COVID or any other virus that would dictate he needs to be isolated. So I'm going to have him call me back in 2 weeks if he's still experiencing symptoms. And I told him that I'll be sure to give him the results of his lab work once I get them and I can send them to his portal. Then I click stop and the note wraps up. It takes about a minute to generate, and then we can take a look at what this structured SOAP note looks like. As you can see, a perfectly structured SOAP note was created within a minute of that stop recording button being clicked. We have a full subjective section filled out, pulling in their demographic details and anything that was described in the visit. And then what's great is these ICD-10 codes populate based off what was said during the actual visit. And you can go in and edit those and add something else or remove something. And then here is your perfectly structured plan. And again, right from here, you can order medications, vaccinations, labs and studies. And we also have an integration with FullScript so that if you want to order, say, zinc for this patient as a supplement to help him in healing faster, you are able to do that as well. So once we are done with this encounter, I can click Capture Charge, and now this is already set up so that we can expedite our billing.
And that's what a connected clinical day looks like in Tebra. Intake flows into the chart, documentation takes minutes instead of hours, and orders happen in the same system. And importantly, as Hannah just showed, all of that clean data flows straight into billing. So Kevin, let's look at what happens when it's time to get paid for that work. In our survey, we found that on the revenue side, the story is stark, which is probably not a surprise to anyone. 53% of practices have clean claims rates below 90%, and 28% spend more than 21 hours a month on claim rework. And at the same time, 60% say better collections would most increase their confidence in staying independent. The gap between revenue earned and revenue collected is a huge pressure and a huge opportunity when billing connects to the rest of the system. So Kevin, where do disconnected billing workflows usually go wrong, even when the clinical side is doing good work?
Yeah, so this is something we see across the industry. Billing breakdowns usually aren't clinical mistakes, they're connection issues. So even if a provider documents perfectly, everything can fall apart in the handoff between disparate systems. So when the EHR, scheduling, eligibility, and billing don't speak the same language, you get a different amount of things that can happen, like mismatched demographics, charges arriving as PDFs or maybe handwritten notes, eligibility not being checked in time, missing modifiers or missing, attachments that's necessary, or even an inconsistent coding. Every one of those issues creates a rework loop that eats hours out of each month. And that's a big reason why more than half of practices report clean claim rates that are below 90%. With Tebra, that handoff problem disappears. Structured data flows directly from the visit into the claim. Issues are caught up front, and the biller isn't living a constant cycle of preventable, cleanup.
Can you share how a practice like Celebration Speech Group tightened collections and reduced leakage once they brought scheduling, billing, and payments into Tebra?
Yeah, sure, absolutely. So Celebration Speech Group is a perfect example of how powerful connected billing can really grow practice. When the founder started accepting insurance, billing became much more complex with credentialing, super bills, and payer required documentation and reviewing notes. Everything just increased. She was spending time too much on billing and not enough time on patients. So once she moved to Tebra, that friction kind of dissipated and disappeared. Our EHR and billing workflows worked seamlessly together, so notes supported the claim, eligibility and documentation matched what the payers needed, and the billing and payments portal dramatically reduced the administrative burden. She could scale confidently because the workflows were predictable instead of chaotic. And as a result, it kind of speaks for themselves. She expanded from seeing patients at home to operating 3 offices with 20 providers and staff. That's what connecting billing can unlock, a real capacity for growth.
Let's look at how Tebra turns a patient visit into a clean claim and payment with as little manual work as possible.
Before an encounter even becomes a claim, you can check eligibility for the patient. Simply click on the patient and click Check Eligibility. If you have a number of patients coming in that day, you can bulk check eligibility for all patients by clicking the Check Eligibility for All up top. So now that we've taken a look at our eligibility checks, let's jump over to our practice management system to take a look at our encounters. To review encounters, simply double-click on Draft Encounters to view your current encounters. Then double-click into a particular encounter, and you can review the patient name and information associated with that patient, as well as the case, to make sure all of our information is correct. Procedure codes will automatically be piped over from the clinical note. And you can set this up automatically, but if you'd like to check codes on the encounter as you have it up, you can do that. You can see here the code check did not find any errors, and then you'd simply click approve.
Thanks, Kevin. So instead of chasing denials and manually posting payments, Tebra is catching issues early and moving money through with fewer touch points. Of course, none of this works without patients being able to find you, book you, show up, and pay without friction. Samantha, let's look at the patient side of the same day. So our data showed that practices using connected tools like digital intake, automated reminders, and online scheduling are more likely to report improved patient satisfaction, staff retention, and online reputation, and are more likely to be growing. Optimal Psychiatry and Wellness is a great example. They scaled from 1 to 10 providers by connecting intake, ordering, prescribing, and reputation management in Tebra. So Samantha, let's explore where patient experience breaks down when scheduling reminders and reviews aren't connected to the EHR.
Yeah. So when they're not connected to the EHR, I think the primary pain is felt by the practice. Going between multiple vendors, multiple logins, it's primarily going to affect the practice and their ability to create and have the space, to build those patient relationships. How the connection within Tebra really transforms that is by centralizing everything in an all-in-one platform. As mentioned with my peers, Hannah talking about the clinical EHR, and Kevin with the billing and payments, having a seamless flow, all of that data relates to both the clinical, billing, and payments aspects.
I'd like to drill into how things change for the front desk and their relationship with the patient.
Absolutely. Practices, their primary focus are the patients, not only patients in front of them, but patients who are messaging them, who are looking for them, and all those different things. So by creating a strong singular connection for practices, patients now are getting the attention they need. They're getting that eye contact. They're having that face-to-face conversation. They're also having a true continuation of care.
So I'm going to turn it over to you to walk through the patient's journey from their point of view, finding the practice, booking, getting reminders and intake, and then hearing from providers after the visit.
Let's walk through the patient's journey from their point of view, finding the practice, booking, getting reminders, intake, and then, the feedback and the reputation aspect of it all. So firstly, with Tebra, we're making sure that you're found online. So that means through Google search, that means through, even in the maps. So if you're searching, whether that's mobile or on desktop, if I'm looking for a specific type of practice, or even if I'm just searching my actual provider, making sure that you're found at the top and the right information is provided. And most recently, that means being found with AI. So here I have an AI mode with Google and showing, providers and the information that's really salient to make sure that you're being shown to the right individuals. So with all of that, that is just general online presence that Tebra is optimizing for. And how we're doing that is actually through our various products, which includes our web profiles. So for online presence, we're making sure that your practice as well as your providers are showing the right and accurate information across 85 different plus online profiles. That helps to build your online recognition and authority. We're also providing through Tebra access to a healthcare directory where our providers are actually going to show not only their information, their different reviews, but they'll also have direct access to book online as well. And that's through Tebra Care Connect. Outside of Tebra Care Connect, patients can also find you, and this is either through search, through your Google business profile, through your many profiles, but they also have your specific healthcare practice's website. And so that'll display, the prominent aspects and highlights about your practice. So your general about, your mission, different conditions and services that you may want to highlight and provide, as well as just any slogans, insurance information, really anything end to end. That also includes, linking to our payments area where we're connecting to our portal to pay your bill. Overall, it's really creating that ease for both the patient and as a result, benefiting the practice. And so here's a great example. If I'm a patient who I just came across RMS Health, I'll also be able to just book directly online. And what's great about this aspect is it'll sync directly into my EHR and practice management system. So this is live interactable data. So I know, for instance, within the next hour, there is an availability. So I can go ahead and click here, include my reason for the visit. So let's say I'm coming in for a consult, including my name, and that'll actually kick off similar flows to what Hannah showed us, where we're creating, that initial patient information. So once I've actually confirmed my appointment, I'll actually receive appointment confirmation via email. So in this case, as a patient, but I have, my appointment's been scheduled, so I have some sort of confirmation that also goes to the practice within their EHR as well. Flashing to what's happening on the practice's end, practices are able to actually configure and customize their different patient communications. So in this particular case, we just saw the appointment confirmation email. We'll also then provide any updates. Let's say if we change the appointment or update any details manually. And then we'll also have a series of appointment reminders. However, since I've made one for within the next 2 hours, we're actually not going to get a reminder. And that's very intentional because I'm booking it for pretty close to current time. And then after the visit, we'll also go through different surveys and we also have options for recall as well. So from all of this communication that we've set out, let's say that I booked an appointment and then as the practice, I'm actually sending out intake. And so from text message here, this practice has actually requested for me to fill out the intake form ahead of time. And so what I've gone ahead and done is clicked into there. All I needed was my date of birth in order to get started. So nothing super complicated required on the patient side. And then once I actually fill out all of my intake information, it'll then have a confirmation view of you're all set as the patient. Hannah on her side has noted, hey, this visit has been completed. The practice itself is working on, the charges and the billing and collecting payments. While Tebra, on the other hand, is now kicking off several other workflows, which includes requesting for feedback. So Several hours after the visit, we'll actually ask patients for feedback, both in the form of email and via text message. And then if I actually click on either of those, it'll take me to our form here where we'll actually be able to rate the experience. So let's say I had a fantastic experience. I click next. From here, I'll then be able to leave a public review. And then depending on the different settings, we either may have a survey like this, or we may route the patient to Google Business Profile or any variation of profiles, depending on the custom settings. And so from here, we can go ahead and type in a testimonial and then click submit testimonial. Let's say I want to be proactive about my reputation. I want to make sure, hey, am I responding accordingly to things that are coming in? So as the practice, again, in the same system, we're actually going to go under our patient experience area and reputation. And here is where we'll actually be able to see new reviews populate, overall AI review summary. So what's awesome about this particularly is it goes through all of your reviews and it'll actually create different categories and segments. So as the practice, I'm able to utilize this information for, monthly staff meetings, being able to see really clearly where I'm falling short and where I'm excelling. So let's go an example and reply to an actual business review left by a patient. So we look at this review here left by one of our patients, and he said his visit to Apollo was outstanding, and we don't have any reply, likes, or anything. So as a practice, I want to make sure that I'm providing a continuation of that relationship. And so I want to make sure that Kevin knows that we heard him and that we appreciate his feedback and overall just his ability to publish this online. So we actually see his review here. And then using our AI review reply, I'll actually click here and generate a reply in seconds. So what's awesome about this is as an admin, I no longer have to be in the right mindset to be writing. I could be doing other things. And then what's awesome is it provides that kind of first draft. I can go ahead and take a look, make sure I'm okay with it. Overall, this is an A+ response. I'll go ahead and click reply. And then from there, it'll actually then note the response. It may take a couple seconds in order to register that. But in the end, that response will then populate in Google Maps here. So if I just refreshed it and we saw the actual response that I just put in our platform. And so from here, you can see my response is both in the platform, but it also shows up on the actual Google profile. So end to end, we're not only providing ease for the patient in finding the practice, connecting with the practice and providing the right information, but we're also creating ease and creating automated and AI-powered workflows to ensure that patients are continuing to be heard and that practices are using that information to build stronger relationships in the overall patient experience.
So from the patient's perspective, this feels like one continuous experience. Easy to find you, simple to book, no clipboards, clear follow-up. For your team, it's fewer phone calls, fewer no-shows, and better reputation, all inside the same system that runs your schedule, charts, and billing. So our State of the Independent Practice survey, in which we surveyed over 100 private practices, found that 67% of independent practices plan to stay independent over the next 5 to 10 years. And almost half say the state of independent healthcare is good or excellent. So the belief in the independence is still strong. But 45% say the independent model feels very or extremely threatened. And the top pressure lines are familiar. Insurance reimbursement at 75%, staff wages at 55%, technology costs at 42%. The practices pulling ahead aren't working harder, they're running on connected systems. And that's exactly what Tebra does, connecting EHR, billing, and a patient experience. So automation doesn't just exist, it shows up as fewer fires, fewer rework loops, and more usable capacity in your day. So when the three of you hear those numbers, what's one moment in the day you immediately think of that's either chaotic or calm, depending on how connected a practice is? Hannah, I'm going to flip to you because EHRs are loved or hated.
I'm going to say for the EHR side of things, it's that last patient of the day. So in a disconnected setup, that's when providers realize they still have a stack of notes to finish, labs to chase down, and prescriptions sitting half done, so the day keeps going long after the clinic closes. Whereas in a connected EHR, that same moment is calm, notes are basically done, orders are already placed, and the provider actually gets their evening back.
Let's say probably for billing, it's the moment the claim first enters a queue. Like if it's a disconnected setup, the codes don't match, documentation, maybe demographics are wrong or eligibility wasn't checked. Maybe you're missing like claim attachments and those types of things. And you're not going to discover that until the denial shows up weeks later. But in a connected workflow like Tebra, that same moment is pretty calm. The data flows clearly from the encounter. Scrubbing technology catches issues early on, kind of before that claim's submitted. And the biller knows, where the claim is. They know it's accurate before it leaves the system. So it's really the difference between constantly firefighting and actually kind of feeling in control and monitoring what's going on.
The one moment that I immediately think of that's chaotic for practices and for patients is the whole concept of getting found online. If I have an existing provider or I'm looking for another provider, the ability for me as a patient to be able to find that practice, find the right information, easily drive there, get an Uber, whatever it is. I think that level of friction that can happen at every single step is so high for the average practice. And this is a huge problem, not just for patients, but for practices. If you're not making it easy for your existing patient base, you're risking loyalty. And if you're not making it easy for prospective patients, well, there's your patient growth out the door.
The pattern is simple. Where disconnected systems create friction, Tebra's connected platform creates capacity. Practices that connect their EHR, billing, and patient experience are more likely to grow without adding staff, reduce time to payment, and see happier patients and teams. This is what it looks and feels like in a real day with Tebra. If you're thinking we're living some version of that disconnected day, the next step is simple. Schedule a conversation with our team. We'd love to show you what a connected day with Tebra could feel like for you.